Hello, I am David Anderson. I serve as chairperson of the Master's Level Psychology Advisory Committee of the Kansas Behavioral Science Regulatory Board. I ask the members of the advisory committee to respond to a roll call to signify their presence at this open meeting that is being conducted remotely by conference call and other electronic media. Danielle Johnson, who I understand is not present. Shelley Duncan, also not present. Susan Montague.
Present.
Iris Pauley.
Present.
Thomas Pletcher.
Yeah, present.
Joshua Tanaway.
Present.
I note the following staff members are also present: David Fye, Leslie Allen,
Here.
and Ashley Van Buskirk.
Here.
Next, David Fye will read a message concerning this meeting being held remotely.
Thank you, Dave. And I'm hearing a little bit of feedback, maybe like a clicking noise. So just wanted to let you know that I'm picking that up a little bit. This is David Fye, Executive Director of the Behavioral Sciences Regulatory Board. Public comment allows the public to address the advisory committee about its concerns, but the Kansas Open Meeting Act, or KOMA, does not require the advisory committee to provide public comment or answer questions from individuals. Individuals requesting to provide public comment could contact the executive director prior to the meeting by sending an email to david.fye@ks.gov. There will be no public comment at the meeting today, as no individuals requested to provide public comment. Because we are conducting this meeting remotely by conference call and other teleconference ability, I state for the record the following information. The meeting is being conducted remotely. However, access to the meeting is being conducted by medium of interactive communication that allows members of the public without cost to attend the meeting through the use of the conference call and on the board's YouTube channel. While the meeting is being conducted remotely, the requirements of KOMA are not suspended. As such, we'll be conducting this meeting pursuant to KOMA. On April 9th, 2021, we sent notice of the advisory committee meeting to all individuals who had requested notice of the advisory committee meetings. The notice was also posted on the board's website, ksbsrb.ks.gov. You may obtain a copy of the notice at that website. An agenda and other meeting materials was posted to the board's website on the day of the meeting. You may also request a copy of the agenda by sending an email to david.fye@ks.gov with the subject line request for the agenda, and it will be sent to you. The notice contains information for the conference call and YouTube channel that allows the public to attend the meeting free of charge. The notice also states that if there are any technical issues during the meeting, you may call the board office at 785-296-3240. A recording of the meeting will be available on the BSRB YouTube channel following the conclusion of the meeting by using the link on the meeting on the agenda.
Thank you. The meeting is now called to order, and the advisory committee will begin its discussion on the first agenda item. So, any additions to the agenda? All right. Can I ask for a motion for approval of the agenda?
I move.
And I'll second.
Okay, it's been moved and seconded. Any further discussion? All in favor, say aye.
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 Right. Review of the minutes. Everybody had an opportunity to look the minutes over. Any additions or changes? If not, I would accept a motion to approve the minutes.
So move. Second.
Okay, moved and seconded. Any further discussion? All in favor, say aye.
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 Okay. Next, we'll have the executive director's report.
This is Dave Fye, Executive Director for the BSRB, and I will give you a few updates, some general information and some information concerning legislative updates, and also some information about the BSRB office. First, in terms of general updates, the state of emergency that has been declared during the pandemic did expire on June 15th, 2021. So the state is no longer under the state of emergency. As it relates to the BSRB, there had previously been a series of executive orders that had gone under the pandemic and under the state of emergency. One of them affected licensure, and it had to do with regulatory boards. Essentially, due to these executive orders, it delayed the enforcement of expiration of licenses that had occurred during the state of emergency. And so licenses that had expired from basically back in March of 2020 through just recently, the executive orders had said, go ahead and encourage people to renew, but if their license expired, it will treat it like they're able to continue to practice. The last state of emergency back in March 31st, it was expected to end and another was issued after that point. But at that time, executive orders were issued that were a little bit different in the language and provided regulatory bodies some flexibility so that if they chose, they could go back to enforcing the expiration of licenses as normal. And so at the board meeting on May 10th, we brought this language to the board and we expressed concerns about not enforcing the expiration of these licenses, partially due to making sure that we had consistent revenue and making sure that we were providing good information to licensees as far as the timelines for needed to make sure their licenses were renewed. So the board did go ahead and say on May 10th, they provided direction that after May 28th, they would like the agency to begin enforcing the expiration of those licenses, and that even if there was another extension of the emergency after May 28th, as long as there was flexible language allowed, to go ahead and enforce licenses as normal after May 28th. So the executive order that allowed that flexibility said 15 days notice had to be provided to licensees. So we went ahead and sent out a message to anyone whose license had expired, they had not renewed. We also posted the information on the BSRB website, and we moved forward after that point. There was another extension of the emergency to June 15th. But as I said earlier, now as of June 15th, the state of emergency has ended. So I'm going to give you an update on how it affected licensure. Another item I want to make you aware of concerning some legislative updates. First, during this spring, the BSRB had a number of items before the legislature in terms of statutory changes for licensees and also for the temporary out-of-state permit. And these were put into two different bills, House Bill 2208 and Senate Bill 238. Each of these bills worked through the different chambers, went through committees, were passed, went to the floor and were passed and went to the other chamber and moved forward. House Bill 2208 is really regarded as the final version of the BSRB bill. Along the legislative process, several other bills were amended into House Bill 2208, and that bill was ultimately passed. The final version of the bill included other provisions, including things like certification of certified community behavioral health clinics, enactment of the Rural Emergency Hospital Act, and created a category of licensure to enable Kansas hospitals to receive federal healthcare reimbursement for as rural emergency hospitals, and authorized out-of-state physicians with telemedicine waivers to practice telemedicine in Kansas. And as I mentioned, the base of the bill was statutory changes for licensees under the BSRB. But the bill has passed. It was signed by the governor. This bill did have a ceremonial signing about a week ago, and it was largely praised. I believe I heard references to paraphrase. Some individuals spoke so highly of the bill that they said it was the best mental health bill in the last 30 years. So I think it speaks very highly. I know that there were other items aside from the BSRB items in the bill, but I think it's nice to hear these comments from members of the legislature, and it was nice to see that the passage of the bill. The other bill, Senate Bill 238, essentially became a shell for other contents, so you don't need to worry about that, but it became some contents, I think, related to the Board of Pharmacy and another bill. So in reference to the BSRB changes, that would be House Bill 2208. The bill was changed in conference committee so that the effective date was modified from upon publication in the statute book to upon publication in the Kansas Register. This is a weekly publication from the Secretary of State's office. And this was published, I believe, either at the beginning of May or at the end of April. And we sought the board's direction in terms of implementing the bill at the May 10th meeting. And we received some clarification from the board. And in May, we launched the implementation of the provisions in the bill. And we had several updates to the BSRB website. We put together a letter describing the different items related to licensees in the bill, sent that out to the BSRB licensees, and posted that information on the board's website. Just to highlight some of the items that were affecting licensees in the BSRB portions of the bill, As a reminder, that bill did lower the number of postgraduate supervised work experience for individuals seeking a clinical license down from 4,000 to 3,000 hours, and also lowered the number of direct supervision hours from 150 hours to 100 hours. And that did affect master's level psychology. There was also a change in the bill that had to do with the way that supervision could be attained. It clarified that all clinical supervision hours could be completed over televideo rather than requiring hours to be in person, and allowing all supervision to be face-to-face rather than person-to-person. And that included the profession of master's level psychology. There was also some language that said under extenuating circumstances or as determined by the board, supervision could be attained by telephone when approved by the board in those extenuating circumstances. There were a couple other items that involved discipline that were put into the bill that affect all of the professions. And then there were some changes to the temporary out-of-state permits that lengthened the amount of time, but put in place a couple of different checks in terms of providing reports back to the board and changing the expiration date of some of those temporary out-of-state permits. So wanted to give you an update and a reminder on some of the items in the BSRB bill. We have gone ahead and moved forward on the implementation of that bill. Another bill was passed by the legislature. It was House Bill 2066, and that bill involves expedited timeframes for licensure of military members and military spouses. And it also has provisions for a different expedited timeframe for individuals seeking to establish residency in Kansas. And then some select individuals who already have established residency in Kansas. And so that bill's effective date is upon publication in the statute book. We are moving forward and making changes to the BSRB documents in preparation for that bill to be implemented. And we expect that to be implemented when the statute book is published. We think that will be sometime in July. Another one bill that you have asked about previously, and that is the SIPAC legislation. That is the multi-state compact primarily for telehealth services. That SIPAC bill was originally 2209. It was changed in conference committee and the contents were put into Senate Bill 170, and it did pass. The SIPAC legislation has an implementation date of January 1st of 2022. As I mentioned, it includes licensed psychologist or PhD level psychologist. And so that's the status of that bill. Concerning some of the items for the BSRB, I wanted to make you aware of. As I mentioned, the state of emergency ended, and back in about mid-May, the governor's office and Department of Administration provided direction to the agency to have all staff return back to the office starting on Monday, June 14th. So this has been the first week that we've had all of our staff back in the office. While it was encouraged to have all staff members back in the office, they did provide some flexibility for agencies that they wanted to develop a telework official policy. And so we did evaluate that and look to see if it would be appropriate for our staff. We modeled a telework pilot after the Department of Administration's telework policy, and we have implemented that telework policy on a very limited basis. We're going to do a trial run through December 31st, and anybody who is a staff member of the BSRB who wishes to do that will fill out some documents and then have a sit-down meeting with myself and the assistant director, and we'll go through to see if it's appropriate for them and make sure they understand the different requirements through this telework policy. So that is something we have rolled out, and we're going to be evaluating it. And if it is productive, we can expand it further. And then just the last item I wanted to make you aware of, we are approaching the end of the fiscal year. The fiscal year does end on the state June 30th. However, for certain things to be resolved by that time, we have to get them done a little bit ahead of time. So I've been working with the Department of Administration and some other offices to make sure that our end of the year encumbrance and other matters like that are resolved moving forward. So I can stand for any questions you have on any of these items, but it's been, as you can probably tell, pretty busy here in the office, and we expect that to continue into the fall.
Dave, is there anything more you can say about the expedited process for members of the military, their spouses, and people planning to or who have relocated? What group, who in that final group, the people who are planning or recently relocated?
Yeah, so in terms of the expedited timeframes, the military members and military spouses, The expedited timeframe, it would be 15 days after their packet of material was complete. So we would go through the process to receive that information and obtain any necessary documents. And then once we have a complete file, there would be a clock of 15 days to make sure that those licenses are processed. For the individuals seeking to establish residency in Kansas, it would be a different period of time, and that would be 45 days. And a lot of the provisions in that bill, essentially, they do not refer to initial licensure. This has to do with individuals who have a licensure in another state or jurisdiction, but they would be moving to Kansas, and hopefully that provides a little bit more information on those individuals. So it wouldn't, it would change the way that we would be reviewing some of these applications. There's also some language in the statute that instead of using a substantially equivalent standard, it would be using a scope of practice standard. And Leslie, do you have anything else to add to that summary on the 2066, the military bill?
No, I think that covers.
What's the difference between those two things, the scope of practice?
You want me to answer?
Sure. Yeah.
Okay, so the scope of practice means, basically what you can do as a licensee. So it's going to open it up quite a bit, I think. There are states that don't have substantially equivalent requirements, but the scope of practice for the license is the same.
So somebody could come from a state where substantially less hours were required
Yes.
and then apply essentially for reciprocity under the scope of practice.
Yes. The biggest thing that we have, especially now that the post-grad hours are at 3,000, I think the big issue now would be the degree and the education, what's required for the education, because there's still states that only require 48 hours, or I would hope not 36, but there could be in their graduate programs. So that would be probably the biggest place we would see the difference.
Well, and one other item about that bill as well, the bill does require some tracking, and this is not unique to our agency. So this refers to a lot of other regulatory bodies, but essentially starting July 1st, or as soon as the bill becomes effective when published in the statute book, we would be keeping track of any individuals who fit into those categories and keeping track of when their application was received, when it was deemed complete, and then when it was finally processed. And then there'll be a process which will be providing a report at the end of the year, essentially, on the number of individuals who fit into the category. So we'll be keeping track of which individuals are applying for licensure under the provisions of this new bill. But as Leslie and I both said, this will change some things quite a bit in terms of the licensure qualifications for certain individuals.
Curious how many of you all have have gone through a renewal of your license in the past year. Okay.
I'm getting
So
ready to here.
So it's if you haven't been to the new and improved website, it's I think a much more user-friendly process once you get through that kind of initial step.
That page has been the page you were having trouble with has been corrected too.
But anyway, it tracks online where you are in terms of having a complete application. And so you'll know if there's something holding it up, it will tell you there instead of having to call the office and asking them to kind of do that by hand. And then I think I got notification the same day I completed my application.
The really, really good thing, I think, is that it's real time. Like So when you renew your license and you're done, provided you're not audited, because then you go into a lockbox. You could go back on within 5 minutes and verify your license, and it shows you that your license has been renewed. So if it doesn't, that means it's in our lockbox for something, usually an audit, but could be other things, question wasn't answered or something. So that's really exciting. And then you can even sign into your personal information page and print off your wallet card.
I did have a question about initial ones. Is there a time frame on initial, those that have just graduated?
It depends. What do you mean? Has the form been sent in?
Yes, like they've sent in all their stuff and transcripts. Is there a time frame from, you were talking about time frames kind of on like the military and out of state? Is there a time frame on initial, those that have just graduated?
Not really, because it depends. Everything's coming in. We have a big number of incoming mail. I think, generally speaking, the licenses are being issued within a week. And they will get a card by email, but they won't get their wall certificate until later, because people are actually helping to license because there's so many. And usually when the last piece of information comes in, which really right now the big one is Sammy, she's getting those entered, and they should receive the original license request form that they can send in within a week as well.
If it takes over a month, should they be calling?
Yeah.
Well,
if you want to email me a name, I can look that up as well.
yeah, and we have, an internal goal of, once we have all the information we need, we try to process that application at least within 30 days after receiving a completed application. And we try to communicate that. And during the pandemic, some of the situation has been a little weird with having certain staff members work from home a great deal of the time. But now that we're all back in the office, we're kind of moving back to a normal way of doing things in a lot of the licensure processes. I think what can be confusing for certain individuals is they may interpret it as it's a 30-day window from when I begin my application process. And there's certain things in there that can take quite a bit longer, such as getting registered and then taking the examination and then following up on any details. So the process can take quite a while if there are things that and for individuals who may not pass the test the first time for licensure. So, but we are trying to move back to moving things more quickly. And just kind of as a note on that a little bit too, concerning licensure and sort of some changes, we moved to the online licensing system for the renewal process. And just recently we were working with the Board of Healing Arts, which oversees that database for us. And part of the new agreement for the next fiscal year, we were talking about certain terms and different goals that we had for the next year. And one of the things that I did negotiate with them is we added some language to that agreement for the next fiscal year that said during the next fiscal year, it's our anticipation that we'll begin the process of beginning to start implementing some of the initial licensure requests through the online system instead of it all being through the mail and paper right now. So we are moving in that direction, which I believe should also speed up the time frame. It may not be complete by the end of this next fiscal year, but we're moving in that direction, which I think is kind of exciting.
I'm not sure if the rumors that people are coming to me with are true. They're telling me that their license are being delayed just because of the number of influx of out-of-state people applying. And I don't know if that's true or not true. But then their comment is, well, Kansas residents should have priority. So I don't know if that's true or not true, but I just thought I'd share what people are coming back to me with.
I can't say. However, there are a lot of reciprocity applications. It has increased dramatically. But the licensing specialist for the in-state licensing aren't through me. I do reciprocity and they do, other people do the people that are just making standard applications. So I don't think it would influence them that much, but I can't say for sure.
I just thought I'd share what the rumors are, whether they're true or not.
People get things.
Anyone have any other questions before we move on? All right, next on the agenda is old business. First item is adding a member to the advisory committee, and Dave located some information around the advisory committees, and I think what it said, correct me if I'm wrong, Dave, is that people could serve for 2-year periods on an advisory committee.
Yeah, it's kind of the reverse of the board, because the board can serve 2 4-year terms and advisory committee members can serve 4 2-year terms. So it's still the same amount of time, 8 years. But that's sort of the limitation. And that was from a board governance document that had to do, the limits on how often or how long people could serve as advisory committee members.
So we've got a couple, I think 3 folks who've been on longer than that, but given the circumstances, what our plan will be is to next year, well, we'll try to add 1 or 2 this year, drop somebody, a current member next year, add a person, and then every successive year, drop a person until we get under those kind of guidelines. But we don't want to kind of purge all of our great knowledge base right away and then have an advisory group that's just brand new folks. I was not able to find, I had cleaned out my previous responses to our last call for new members where we got Irish and Josh. So we will send out another request for people to apply, and if we get the kind of response we did last time, which was fairly robust, then I'll try to whittle it down to a manageable number to bring back to you all for discussion. But I know we had talked a little bit last time about looking for underserved regions. It sounded like kind of the Northeast and Southwest, or maybe Southeast. Other types of consideration, I know one of the reasons we had asked Josh to join us was his private practice experience and university experience. So we were trying to make sure we were inclusive of the types of providers as well. Feedback on that?
I guess diversity of types of agencies would also be a consideration, because the difference between mental health centers and non-mental health centers would also, like Ember Hope, St. Francis, places like that, that provide different kinds of services than what mental health centers do.
Very good. And so we could look for maybe inpatient or PRTF, people working in the school systems. Hopefully we'll get a nice, robust response. So Dave, can you, I don't remember how we did it last time.
I think I could work with you in terms of putting together sort of a letter that could be drafted to go out to practitioners, kind of indicating that the board is looking for interest in members serving on the advisory committees, and then have them send information into the office, and then we could collect that and then kind of go from there, if that would be something that you'd be interested in.
That sounds perfect. Everybody comfortable with that plan?
Sounds good to me.
Next item, we talked a little bit last time about records of deceased providers. And I also wondered, because we had a recent experience at my place of employment where the provider didn't die, but they closed their practice. And when records were requested, there was no response, and it was unclear, as the provider apparently left the area, where those records went. So different situation, but same kind of circumstance around safeguarding patient records. Have you all had an opportunity to think some more about what you think the role of BSRB is in trying to ensure that?
Well, Dave, and I think it might be helpful. So this topic was discussed by the board back at the May 10th meeting too. And the board did hear comments from a number of the advisory committees that had a chance to discuss this topic. And so there was some thoughts from the different advisory committees as well. And I believe that the board does intend to go forward talking about this issue in greater detail. At that last board meeting, they talked about perhaps at the September meeting that's going to be in a different location, the one that's planned to be in Olathe. They were talking about this being one of the topics they wanted to talk about in greater detail at that meeting as well.
Do you recall, Dave, what other advisory committees who had previous discussions about this, kind of what their thinking or recommendations initially had been?
Yeah, I believe there was a good discussion by a number of the advisory committees, and the feedback at the board meeting. I believe that the direction seemed to show support for adding a line to the renewal application, so that when individuals apply for renewal, they indicate that they have a plan in place for someone to be essentially the custodian of their records should they pass away. So adding something like renewal process to have something in place. And then perhaps maybe something, this would probably be something to adjust in the regulations, I would think, but noting support and why that, basically saying that practitioners should have something in place for this too, not just putting it into the applications themselves, but also adding it to the regulations as a responsibility that practitioners should be aware of.
Would there be a mechanism by which that could be checked, or is that strictly we're just going to ask them to complete that, and then if we
If I remember right, I think there were a couple of options on that were discussed. One option could be to just make them go and affirm that they have something in place for that. Another thing would be to put down who would be the custodian of the records. So both of those could be options, but one would ask the applicant to actually say, who would they contact if something should happen to them.
I would think you would want to know who that is. I can just see problems coming up if it wasn't identified.
Yeah, I think that's a great point, because if something happened and people contacted the Behavioral Science Regulatory Board trying to figure out, and you were able to ascertain from their application who they had noted, it would at least give you someone to point them towards. And it might also be a way to do some random checks.
Yeah, now that you bring that up, that was discussed too, that this could be potentially part of sort of like an audit process, that if things are checked, that could be something to be verified. If it's not specifically listed there, but something to go through and verify that people do have someone in place for those things. But
Do you know, was there a discussion about any criteria for who could hold those kinds of records? So the plan isn't it's just going to go in my grandma's basement and
so I don't recall there being much discussion about who could qualify for that, but do you recall that?
Not specific, well, they talked about like following the professional, your ethics. And they did say that it would need to be someone that would qualify, because there are people that like do the court assessments and things like that, and you can't always release all records from a file. So they did discuss it, but they didn't come up with a specific answer.
very good. Anybody have other thoughts that they would like to, Tom?
I was just thinking, and I am fully supportive of making sure people have a plan. It also seems, though, that if we get too far down the path of auditing and checking on these things where there is no regulation, we're sort of imposing on a rule that doesn't exist.
And was
Yeah, I
that,
think-
Dave, your reference to needing to then look at the regulations around this?
Right. Yeah, I think we would kind of go hand in hand with that. I think the applications themselves, the renewal applications would call for that information, but we would need to add information to our regulations to clarify that would be a responsibility of practitioners, and that would kind of justify its inclusion in the application.
Everybody comfortable with that? Adding that to the application, requesting the name and contact information for who would take ownership of those records.
Yes.
Well, I think some sort of question about that, and I defer to the whole BSRB board so that what we are asking for does not vary from one sub-discipline to another.
Absolutely. And if there's anything that the whole board has been trying to do recently isn't that right, Leslie, is to get all the professions to be as similar as possible.
Yes, definitely. It's not as easy as one would think.
Yeah. Yes. All right, next item. HB 2208.
Yeah, and I summarized that mostly in the executive director's report, but yeah, if any individuals have questions on that, that is still posted on the BSRB website, and we do have a pretty good letter explaining provisions, which we could provide to anybody if they have questions on this.
Okay. All right, under new business, the first item, and I believe this came out of the licensed psychologist advisory group. A proposal discussion around CEU requirements for diversity, inclusion, and equity. Dave, you or Leslie want to speak a little to that?
Sure. So, yeah, at the this was at the, I believe it was the April meeting of the Licensed Psychology Advisory Committee. Two individuals from the Kansas Psychological Association, or KPA, asked to provide public comment, noting that they supported changing to the rules on continuing education in terms of requiring specific hours under the areas of diversity, inclusion, and equity. And I've been attending meetings at the national level for some of the different associations. And there have been similar topics that have been discussed at the national level, such as for professions like social work, discussing the value of adding something like this as a requirement for practitioners. At the Licensed Psychology Advisory Committee, what they discussed was, some of the different items, such as, you wouldn't want to add any additional continuing education hours in terms of the total number that you would have to receive over the licensure period, but it would essentially be a change to say that of the hours you need to attain, 3 of those hours would be in these areas. And there was also some discussions by the other advisory committees that talked about this topic as well. And there was some of the questions that were discussed and talked about was, right now there's, I believe, 3 hours that are required in ethics. And for some of the professions, there are 6 hours that are required in diagnosis and treatment. But a lot of that information is now covered under some of the educational coursework. And so one of the proposals was to take the 6 hours of diagnosis and treatment and essentially reduce that from 6 hours to 3 hours, and then more or less in place of that require 3 hours in diversity, equity, and inclusion. One other topic that was talked about was there was concern that too many of the hours would be dedicated to specific topics, which could interfere with practitioners' ability to get classes in a certain area that they wanted to get classes in. So would it be okay to count the same 3 hours for ethics and also count those 3 hours for diversity, equity, and inclusion? And so that was discussed. The individuals who approached the Licensed Psychology Advisory Committee said they were fine with accounting for both. But some of the advisory committee members noted that they wanted to make sure that these things were being taken into account. In terms of what the BSRB currently does, we wouldn't really double count unless there was a change that was made. We look for what 3 hours can we identify as ethics, and then with the hours that are left, what hours can we identify for the other requirements? So that has been more or less the discussion. It is happening at the national level. There are states that are considering adopting similar requirements. So hopefully that summarizes kind of the discussion at the national level in the advisory committees.
Thank you.
I actually, more comment too, sorry, the Licensed Psychology Advisory Committee did indicate that they were in favor of going ahead and making a change to this topic, but and they discussed that at the board meeting, but the board did talk about at the May 10th meeting that this would be a good topic for all the advisory committees to discuss, partially in the interest of having similar rules for all the different professions. And one other bit of information is that any change to the continuing education requirements would not only require changes to the regulations, but also to the statutes. So the earliest that something could be done if a change was proposed would be following the next legislative session, because it would need to be something that would be included in a bill for the legislature to consider.
Initial reactions, thoughts? I think it's an important topic. I just wondered then, is it something that's necessary every cycle? And then do other groups or other people who have particularly strong feelings about particular areas of importance. I went to a Ruby Payne training once on poverty, and it was great. You know, and so you might have somebody show up and say, that's really important for everybody to have that kind of training. And how prescriptive do we want to be? And I'm really concerned about limiting the number of hours around diagnosis and treatment, because those are, in my mind, really kind of the core of what we want people to be keeping up on.
I would agree on the limiting the diagnosis and treatment piece too. Yeah, the other thing I think about is that our regulations talk about we should not be providing services to populations that we're not trained within. So, you know, does this fit under that anyway? That if, you know, you're not out in Western Kansas working in an all-white community, should you be looking at getting more training with different populations anyway? I don't know.
You know, I believe that our profession as a whole has shown great tolerance and the ability to work with diverse populations. One question I might have is, what problem is this fixing?
You know, I don't know. They said that it was really important. It's included in pre-doc and post-doc and other things like that. But also, it was brought to the social work committee as a request to try and have that requirement in the continuing education. I don't know if they've decided though. Do you know? Do you remember?
Yeah, I don't recall if that was a specific recommendation or not.
I mean, I remember that someone brought it to the committee, but I can't remember if they finished discussing it. So I mean, we don't really have that answer.
I agree with what most people have said here. I think it's really important. I do feel like we get components of that with the ethical component of CEUs. And there's also components of that. I mean, if you take almost any training in some sort of treatment modality, you know, they're going to be talking about cultural considerations and those sorts of things. So I feel like that is integrated into a lot. And as Dave was saying, my only concern with it would be limiting what practitioners want to train in and sorts of things. I mean, personally, just one, you know, N of one, but I had, you know, like 108 hours of CEUs this past cycle. I was amazed, but it's because I did what I wanted to do and I did the things I, you know, and I would just be worried about limiting people's ability to train in what they want to train in. You want to get certified in EMDR or something like that. That's going to take up your whole 2 years, you know? So.
It's a good point. I know we're running almost, I think actually all of our clinical staff through a 24+ hour DBT training. And so that is going to eat up the vast majority of the amount of time allocated. Iris?
Yeah, I agree. I was thinking the same thing. A lot of the trainings I've been to incorporate that in. And I had the same question that Tom did. Was there a particular reason why? that was being brought up? Are they seeing more complaints with that area or concerns?
In terms of the BSRB, I don't believe we've seen more complaints regarding those topics. And you know, in terms of at the state level, the advisory committees, most of the requests have come from either the associations like the KPA, or I think for the social work, I think that was a request from the public that they just had submitted for consideration by the committee. So.
Does each profession still define the number of CEUs that are required, as well as the specific subtypes under that?
I was actually looking, that's why I was on my phone a minute ago. I was looking at yours, and so each profession does the number of hours. You're set at 50 like psychologists. And the statutes require ethics and diagnosis and treatment. Social work has an additional required course one time. So you do, to a point, you know, decide what it is you want, but those two things are in statute.
And adding something like this would require a change in the statute?
Yes. I'm trying to find. I'm looking for where it has ethics and diagnosis.
Is the additional social work training, is that the safety one?
Yes,
And you indicated that's a one-time only training?
yes.
And were they, the people who came to the licensed psychologist group, were they asking for this to be a recurring, every cycle requirement, or a one-time?
I think it was recurring.
Right. It would be every licensure period.
I think it was KPA, wasn't it?
It was. Yeah.
So when this goes to the full board, will ultimately each group kind of weigh in on whether or not they want to add a requirement like this?
Yes, that was, I mean, when we talked, Dave and I talked about it, since the psychologists were going to move forward with it, we thought that it would be good to have every profession's input for the board, so that a decision could be made.
Okay. And I'm taking the temperature of the group, saying we don't think at this point that there's a demonstrated need that at least has been explained to us to make such a statutory change. We believe that it would be important, particularly as Susan said, if you're if you're going to be involved in treating any particular population, that ethically you be exposed to some material and feel comfortable in your understanding of how to provide that treatment in an adequate manner.
Yeah, Dave, I'm lukewarm at this point. I would say, just using your analogy of temperature, and in part, you know, I do believe that it's an important issue, but we have so many other things that we want our people to be prepared for on an ongoing basis, to take, you know, that percentage of our time every 2-year cycle to get this training. I'm just not convinced that how far it goes beyond being, this is the political whim of the country right now.
Everybody okay with that?
Yes.
Moving on. 988. I assume everyone's aware of the federal legislation to establish 988 as a national suicide prevention line. There is a Kansas coalition that is talking about how we would implement that. And I was asked as a rural provider to join their meeting. And one of my questions was really, I assume most agencies have established crisis lines. And I know we've talked in the past about BSRB has kind of defined that clinicians have an obligation to either themselves or with somebody that they're associated with, be able to handle crises that occur with their patients after hours. So while this conversation was going on, I started to wonder, does that mean people are just going to put on their after hours line, hey, if you're in a crisis, call 988, and use that to kind of meet their obligation to take care of their clients? Because certainly in our system, we have after hours alerts set up that if certain people call in, we want them managed in a very specific way. And the more the people who respond to those calls, the more information they have and the better they understand the patient and the current treatment plan, the better that outcome will be. So I'm interested in kind of where you're all thinking in terms of licensees' obligation, and again, how do we make sure that they understand what that obligation is, and any concerns you might have around, as an unintended consequence, something like this might have.
Dave, is it your understanding that this phone number will just redirect those calls to a local resource, or does it go to a national resource?
It's my understanding that there are certain entities within the state that will take on that contract. So it will be each state kind of creating its own infrastructure for responding to those. But that is what is being kind of worked out as we speak.
So is it significantly different than the current National Suicide Prevention Hotline number in terms of how it operates?
I don't know how that one operates, but I know that 988 then pushes down to the state level to come up with a plan for how each state's going to implement it.
It does not seem, in my mind, to change the requirements on the practitioner.
I don't know a whole lot about it, but I agree with that. I don't, like when we have the National Suicide Hotline, I'm not quite sure. People put that on their crisis stuff. That doesn't negate them from having responsibility for responding to their clients, I don't think. And I don't know a whole lot about the 988 number or what's going on there either, other than what you've told us, Dave.
The other thing, I think part of the intention was with 988 was to divert some calls from 911, but also to catch people who weren't currently in services with anyone. And to kind of have that universal number that everyone would eventually know as a resource. And I think in that regard, in terms of somebody who may not be in services, having a direct line to a trained person seems really, really useful to me. Iris?
Yeah, I hadn't thought about that, but you have a good point of people utilizing it as that, because they've certainly utilized us before. So I can see it happening.
It made me wonder, Dave, as you were talking about adding a box to a renewal application around, affirming a plan for records, whether we could do something that affirmed a understanding of their obligation to have a process in place to meet the needs of their clients in crisis during the day and after hours.
I do like that.
So just taking that path, Dave, however, how many other statutes or regulations or standards are we going to then reaffirm every time we have a renewal? Because we already ask if the person is familiar and following their rules and regulations, and this is one of those things.
So you're not a fan of the 1,000-page renewal application asking people to reaffirm?
Oh, well, I would only be so if it follows logically the statute in order. If it's,
Sure.
if it's, written, forget it.
It could be an open book test.
Well, I think part of part of what we always know with these kind of things is there are some unintended consequences, and maybe just monitoring this as it goes and looking for any kind of issues that are created, and if need be, kind of revisiting that. But I certainly understand what you're saying. Comments back to the prior issue of at some point we ask people to affirm that they understand the rules and regs of their particular profession, and that's certainly one of them. Anybody else want to chime in before we move on?
Have we heard how it's going to be funded? Because the last I heard was there was still lobbyists fighting against the charges on our phone bills or things like that to cover the cost of this.
Yeah.
Maybe that's not an issue around it, but could this come in and then disappear because the 988 number versus the 1-800 national number too? So
I know, Dave, maybe you can speak to that, but I know that there were some plans to add some taxes to phone lines, much like they do with 911, to help pay for the infrastructure of this. Do you know what the current status of that is?
I really don't.
Okay.
I can look into, but I'm not familiar with that.
Well, next we wanted to talk about, given that it certainly feels like we've turned a corner on the pandemic and life has begun to return to normal. How you all feel about future meetings and whether we want to schedule those in person, via Zoom, some hybrid of those who can be there in person, come in person, and those who need to join remotely do so.
And Dave, do you mind if I provide a couple comments on that first?
Absolutely.
Okay. So, the remote meetings were being done pandemic, in part due to some authorization that was provided during the state of emergency. But as the state of emergency has ended, I've been in discussions with the board's legal counsel to get a little bit better idea of what would be required. And as you heard at the beginning of the meeting, the script that we had for the meeting was a little bit different than some of the past meeting scripts. So the board is still, and the advisory committees are still authorized to hold remote meetings. And so those can continue. We just need to make sure that if the advisory committees or the boards are meeting, that there's still a way for the meetings to be open. And that's why we're still doing the conference call and doing the Zoom broadcasting. So there is the option to continue to do it solely by Zoom, or you could go back to doing it in person, or you could do sort of a blended option where you have certain members in person or certain members over Zoom. One thing about the office here, we've received some direction in terms of state offices. As I indicated earlier, this is the first week that we have all staff back in the office. They have instructed us in terms of state buildings, if individuals are vaccinated, they don't have to socially distance anymore. They don't have to wear the masks. But if there are individuals that have not been vaccinated, then it is expected that they are still going to wear masks and still social distance. So should all members be back for a meeting and not everyone be vaccinated, we would have to make arrangements to make sure that we're doing things as we've been requested to do in terms of making sure there's adequate space for everybody and that everybody's following the policies for the state building. But that's just something that we have received direction on. And the same would be true if we had members of the public who showed up wanting to attend a meeting in person. We would still need to make sure, if they're vaccinated, they would have certain seating. And if they're not, we would make sure we have to abide by the social distancing for them and different things too. So just something to weigh in your conversation, but I wanted to let you know what we've been informed about from a legal perspective and also from direction from the state.
I'm all for continuing Zoom meetings, although I would love to see you all in person. And I wouldn't be opposed to that at some point, but I think if we really want to look at getting someone, from the Northeast or Southwest regions too, I mean, I know going to these meetings really will essentially take the whole day. I know it would for me almost, which is a big deal. So not that it's very important, but we all have things in our lives that are very important that take up a lot of time. So I would be good for continuing with Zoom or maybe some sort of hybrid or something.
I'd agree with that. As much as I love the Flint Hills, seeing it, for several hours for a 2-hour meeting, probably not so much.
I wonder if we could, though, particularly as we're going to be introducing some new members, think about designating one meeting where we try to get everybody just in the same room. Because there is something to be said about the time before and the time after and really getting to know each other a little better.
I agree with that. I think that would be nice,
Yep, I agree too.
And would the meetings really have to be in Topeka? Could we find a location in the center of the state and everyone travel into to save some of that time?
Traditionally, we've done them at the BSRB offices because they have at least 3 staff members who attend those meetings. But I don't know that that's a specific requirement.
There would have to be the proper electronic, like we record the meeting. Dave needs, the Wi-Fi to do his magic with YouTube.
Well, there would
Things
also-
like that.
and there would need to be space for the public because there would still need to be the ability for individuals from the public to attend. But those would be the considerations.
All right, so everybody's okay with hybrid model where if people are available and want to be in person, could. If not, they could connect via Zoom. And we will, when we get some new folks on, look at finding a time that works to do maybe a meeting a year and get as many people as we can on site.
That sounds good. Not to be crass about it, but will there be mileage reimbursement?
Not now. The current policy is no.
Okay.
That was taken away years ago when they cut budgets. But it's not something,
Thanks. I thought it had disappeared well before COVID, but I couldn't remember how far back that went.
Yeah.
Very good. Just a kind of an update. Dave and I participated in a panel for camp back in April, and I wanted to take the opportunity to say in front of this group what a great job he did. It was part of a ethics panel, and lots of issues came up, and for a guy who hadn't been on the job very long, I thought he did a wonderful job explaining kind of the role of BSRB and all of the issues that were currently kind of on the front burner for the board. And it was a good opportunity, and I think you were able to kind of participate in a little bit more of the overall camp conference, weren't you, Dave?
Was, yeah, and I appreciate the kind words. That was very nice. I was able to attend the rest of the meetings, and then they had a second day about a week later with some additional speakers. And I've been trying to spend time this year, jumping back and forth between different items in terms of legislative responsibilities and responsibilities to the different advisory committees and the board and the CRC and the different groups here. But also I've been trying to invest myself in the different professions, to learn more about the background and the differences in the professions. And they did have lots of questions during our panel, and they were good questions. And some of them did relate to some of the legislative items that were in the bills. But I came back the following week, and they did have a question that I provided some follow-up information to the members at the panel or the conference. They were asking about the interpretation in regards to the jurisdiction of Kansas, in regards to teletherapy and telehealth services, in regards to that we look at the physical location of the individual receiving services and what that was based on. And so we provided some information in terms of how we go about looking to see where the individual is, and we back that up in the statutes and regulations concerning what we're authorized to do as a state agency, and then also in terms of identifying which individuals we provide public protection for as well. So it was a good discussion and helpful to talk with the individuals from that conference. And so I look forward to maybe going back next year and sitting in on some additional meetings too.
There was some.
The camp board had lots of good feedback, and they've always been grateful when BSRB has come and been a part of the ethics, or sometimes they have been kind of a luncheon speaker for 20 minutes or 30 minutes, and keeping them abreast of changes and the availability of of services that you all do, especially when people have concerns about whether somebody's violating practices or not. So, you know, this just really, I think, reinforces the working relationships between practitioners and our board.
Yeah, and I think COVID in particular, because of the significant increase in services provided via telehealth, really led to some interesting situations where, let's say, like at Fort Hayes, where usually students are on campus and receiving services face to face, but when they were sent home, you know, it created kind of a bind for practitioners because they had a therapeutic relationship with somebody who left the state kind of quickly under adverse circumstances, not wanting to abandon their patient, but also knowing that now that the patient resided outside of the state, you know, what that meant in terms of their ongoing obligation towards that person to, at the very least, help them find services. And those of us who work in areas, you know, with border states where people freely move back and forth. And I know that there were, particularly again with telephonic services occurring, people really had no idea unless they specifically asked where people were when they were doing those services.
Well, thank you, Dave, for the presentation.
Next, we're going to talk about the in-residence requirement. Leslie, are you ready to roll?
I am. So the regulation for education requires that for master's level psychology, specific coursework, the 6 hours in 6 hours in testing and 6 hours in psychotherapy. The regulation requires that that be done in residence at the institution where they're obtaining their degree, and that the courses be taught by core faculty. And there's a definition of what core faculty is in the regulation as well. And so the board has started discussing this because this was written 20 years ago. And there are a lot more online programs, and many of them, I think, you know, of better quality. And so the board has asked that different Kansas universities weigh in on this topic. And so we received information, and that will be discussed at the out of town board meeting in September, to determine if there is, you know, a way of either accepting online or better ways of determining whether or not it's quality that could be put into a regulation. Because we don't have anything like that. It's just, if it's online, it's, you know, unless it's for other professions, you know, counsel on professional counseling education, they have programs that are online that are accredited, but you don't have an accrediting body, so that can't be done for your profession at this point. I know you guys have talked about APA maybe starting to do master's level psychology, but as far as I know, that hasn't happened. And the outcome won't be in until a little ways out. So that's what they're looking at currently.
And this really impacts our group in particular, because if a person, let's say, pursues an online degree from one of these regional or national groups, and then they come to Kansas and they want to get licensed with their doctoral degree, and they can't, then they try to drop down and get licensed at our level. And, our primary issue is protecting the public and making sure that people we license are adequately trained. And, I don't know if it was this year or last year, but we had somebody come before us who was appealing a denial, and they had a degree from one of these groups where they get together regionally, like a large hotel, and they spend time doing training while they're all at this hotel. Part of the issue, sorry. So part of the issue was that doesn't meet the definition of in residence because they're not at the university's physical setting. And again, as Leslie mentioned, that may be kind of historic and no longer relevant. But in one of these situations, it was an assessment course. And they were talking about how they did practice assessments. And when I asked the question, so what did you do around the kids? Because I was really curious about where they got the kids to do practice testing on. The applicant said, well, we have adults who pretend they're kids. So, for me, that was a real, okay, that's not the same thing. And becomes kind of that slippery slope of obviously online training programs are, popping up everywhere, as is online treatment, online supervision. This is where we're headed. But how do we proceed cautiously and make sure that we are ultimately only licensing people who have been adequately training? And maybe adults pretending to be kids is okay. It certainly triggered something deep within me. So curious, again, as to your thinking on this, Josh, in particular, you're a person who spends a great deal of his life dealing with these issues.
Sure. Excuse me. I really believe that we can adequately train practitioners in a virtual model. I am not sure, especially with testing, with keeping some in residency requirements might be a good thing. But for instance, like within residency requirements right now for psychotherapeutic methods, I think that's really outdated. There's no reason why we can't train those theories and those ideas in a very interactive, engaging way with virtual education. I also want to make a note too that some people's perception of virtual education is Zoom, right? We're going to do Zoom meetings and we're going to do discussion boards. And that is just not the case. That's very kind of ancient sort of thinking. I'm developing a virtual course right now, and I'm working with instructional designers from Fort Hays, and the tools out there now and the different things going on are just truly amazing and interactive. I think can do some wonderful things. So I know it'll be a thing that we talk about kind of more for sure as time goes on, but I really think the benefit of it to providing education for hopefully people who will practice in Kansas, maybe even rural areas, is a great thing. So I could go on, but those are my thoughts. Those are my thoughts initially.
Another issue that I'm coming up against quite a lot more recently is military. There are a lot of people now that are coming from the military with online degrees, and they can't be licensed in Kansas.
And is it because of that specific requirement?
Yes. Because some universities don't have a campus, so that you could never be in residence. You know, for some of the institutions that, and I know Walden and Capella kind of got a bad rap. I don't know anything about education or education online, you know, being effective for mental health. But they have accredited social work programs. They have accredited counseling programs that are licensable in our state, but your profession doesn't have that. And they also have ones that aren't accredited and they can't get licensed, but it seems that there is more quality currently in online education. And that should be considered, I think.
But how do we decide which programs are the quality programs and which ones are not, such that we would feel comfortable in supporting those graduates?
I think that's a great question, Tom. I mean, that's what I was thinking about when we first started talking about this. I mean, we don't really monitor the quality of in-person programs. I mean, we have regulations, that, you need to take these classes, but I mean, I don't know to what level we monitor how do those learning objectives go? Are you doing stuff? Who the what level of experience does a professor have? I mean, there's I think a bigger question is just trusting virtual education, period. In my opinion.
Tom, from the board's perspective, it would be in the regulation like it is currently. But there would have to be a different way of determining whether or not online. I mean, now it just says you can't do it. So if you're going to change that, you would need to have items that you can use to ensure that it's a quality program, very similar to what's in the education regulation now.
So part of that problem for us is not having that national group who is credentialing those kind of programs like APA does, or the counseling group that accredits master's programs. Since we don't have that, to Tom's point, then would it be, how do you write a reg that catches all that?
Right.
How often, Leslie, is the issue of core faculty problematic for people?
Honestly, I can't say, because if they don't meet, we don't have to do every single thing. If the school doesn't have in residence, we don't even look at specifically at core faculty. I know it's an issue in regular programs. There are state schools that don't have enough core faculty to meet our requirements, or in the past there have been. I'm not saying they're doing that now, but so it's not just that part isn't a problem just for online, it's for everybody.
Yeah, and I actually wondered if
Yeah.
that was kind of archaic in the sense that now you could have courses taught by somebody with a real expertise in a particular area who's not a faculty member, but rather a highly skilled practitioner, and that might actually be a higher quality.
Right. So Josh, I have a question, just because I've heard things from other board members. Like, okay, well, they're gonna listen to a podcast and do a test, answer questions. Is that an acceptable way of online learning?
I'm really sorry, Leslie. I couldn't hear you, so I was messing with my headphones. Can you say that
Oh.
again? I heard podcasts and questions. I apologize.
Someone said that, a board member said that the online education could simply be, they listen to a podcast on something they're supposed to listen to, and they take a test or answer questions about it, and then they pass that class.
I mean, someone could do that, but it would be, awful. But someone could do that in a regular class too. I mean, you
Right.
could watch a movie and then write a reflection paper on it, and not really get much feedback. There are, and if you want me to talk about it, I can. I mean, I don't want to go overboard or bore you, but
Like a common thing, or if that was kind of a unique problem.
I mean, like I'll give you an example. In the class that I'm developing on abnormality, one of the kind of interactive assignments I'm developing right now is I got copyright permission from it's an episode from ESPN films that I was after. So I got copyright permission from ESPN to post this film on Blackboard. And I have this program through the university where all the students are going to watch it. And while they watch it live, they can clip out specific things within this film and leave clinical observations and different things. And then, we have a discussion about that. There are platforms where you can have very interactive kind of discussions where people are building on each other's comments, and those things are graded. Just really striving for how can people interact in a way that you just don't have to sit on Zoom for 3 hours. But they're reading material, they're engaging with it, they're reflecting on it, they're creating stuff. I have a project that runs the whole semester where they're collecting unique resources based on their area of expertise that they pick for the semester. And they're required to come up with those and present them in a certain way, and they have to be related to how they would use them in practice. And so different ways of trying to get them to think and learn.
My daughter took classes for teaching from Fort Hayes online, and she didn't like it. She said it was harder.
And it's funny you say that. I'm creating this course right now. We have an analogous course on campus, and I'm like, I don't know, this virtual course is gonna be really hard. So I'm actually trying to find ways to pare it down a little bit, because it's heavy, and there's a large, especially graduate students, there's a large section of graduate students just in general. I mean, a lot of virtual students, I mean, they're so motivated, they are really motivated. They're wanting to build and better their lives. And you get ones that aren't, of course, but you get that in person too. And in my experience with, higher level students who are going to graduate school or going to go to graduate school, they can do a really good job with virtual work. So.
Thank you.
Leslie, the in-residence requirement for our licensure revolves around which part specifically, beyond the testing and?
For your profession, it's simply testing and psychotherapy, so 12 hours, which is the same as psychologists, except they have 24 hours in those two areas. The rest, the coursework, can be done online. They still have to meet the program requirements, but especially, if you're like a Kansas school, that part isn't a problem. If it's already a program, then it's not a problem.
So if they're already an established graduate program, but do they still have to meet those two requirements for those courses to be on campus?
Yes. So, we have in Kansas, and we do some Missouri programs as well. The school can request that we review their information and approve them so that they can be considered approved, and we don't have to send them a questionnaire every time they apply. And so we have done that. And then the program, one of those programs has said that everything in the program is staying the same, but they're going to have more options online for coursework. But keeping in mind that those 12 hours have to be in person at the university with core faculty.
Other folks?
I can see the psychotherapy being online. I struggle much more with the testing. You can provide therapy online. You can't provide psych testing online. I just, the training, I can't imagine doing that online. That's just hard. And maybe I'm old school, but that's harder for me.
I did attend some of the trainings in regard to PhD psychologists who were doing online testing, things like that, in other states. And it's kind of a complicated process with how many video cameras you've got to have monitoring and different aspects. I do think Pearson, one of our companies that do a lot of our testing products, is trying to figure out how to make it work. But I really think that for testing, that is a piece that takes a real skill set for training to do. I would agree that the psychotherapy piece, I would wonder if that wouldn't be better doing it by Zoom or some other piece, because a lot of times we had to videotape our practice sessions for our professors, and you can do that live with Zoom and things like that too. So I would wonder if psychotherapy could be changed.
How would you do a whisk or a waste? I mean,
I mean, this one psychologist had all these video cameras set up, and how I don't know enough about how they use the Apple tablets and things to do it. So I don't have a clue about it. It didn't make sense to me, but again, he was really pushing for it and hoping that different insurance companies would open up. So there is a lot of proctoring, testing online now. So I know that's happening in our field. Pearson just came out with a new product through Q Global, where you could do proctoring of, more of the quote paper pencil kind of tests and using it that way. But the Wexler, they have not come out and said, here's what you could do when I've been following their stuff.
well, and I have some people that I'm wanting to have do the ADOS testing, and there is some testing available online for that, but I'm just still a little leery of sending them to that. I would much rather have them do it live. So I'm trying to hold out on that. I just feel
Yeah.
like it is much more efficient with that kind of testing that's very hands-on.
I do know with the kids that we've worked with, doing online psychotherapy pieces, that was a whole lot more difficult because you couldn't pick up on things and kids didn't stay focused. We do have some things that we're doing with a secure care with psychotherapy because the clients can't go in and out, and finding ways to make that work. We've found different techniques that we're doing at secure care to keep kids engaged but we still can't figure out the testing pieces by any means.
It's a good point on the kids too. I mean, there's definitely a difference between doing psychotherapy via Zoom or telephone with adults versus kids. Because with kids, you can't even use like a child-centered play therapy approach because they're not in the setting to do that.
I think one thing that I totally agree with all that. And I'm not saying I support getting rid of in residency completely necessarily, but I think one thing to keep in mind though is that just because we might be training people online, we're not training them to do things online, right? So we might be training people to do in-person testing or training people online to do in-person therapy, right? So it's not necessary that, like, for instance, our school psychology program at Fort Hays, they do the hybrid residency thing where they have for testing, and they spend a full week on campus in the summer doing stuff. But before that, and they're submitting videos of them providing in-person testing, right? So they're training how to do tests in person in an online format.
And I think, Josh, the way you describe that gets to some of my level of, I don't want to say discomfort necessarily, but there are just so many ways in which these things can be done, many of which may be very productive and effective. And the question then comes back to, how do we know if the person who is submitting their application has had their training done in a way that we are comfortable meets the needs of the state, the people in our state? Not knowing as much as you do by far of all the current techniques, I lean a little bit more towards flexibility in terms of the psychotherapy training and probably even the core faculty, just based on how does staffing work now in many institutions, than I probably do on the assessment, though that might change if I was better educated.
Yeah, I'd say, Tom, I'm kind of aligned with what you just said too, and I totally agree that as we go forward with, how, the quality of programs, is there some way to think about that, that would appease people, and that would hold, programs accountable to some degree. It's just a difficult thing to regulate, I think. But yeah, I totally agree with that, what you said.
So, Dave and Leslie, specifically, what will we be asked in terms of reporting back on the in-residence issue?
I don't know that there was anything specific, just kind of have an idea of the committee's feelings and thoughts, and there were no specific questions.
Okay,
Yeah,
but it sounds, go ahead.
This is a topic that the board has been discussing for a little bit of time, and I know these topics have been, relevant to some of the other changes that are happening. But the board didn't specifically say to the advisory committees to go back and discuss this and bring back ideas. But since it is coming up, and the board noted it would to talk about it more at the September meeting, this kind of conversation is very helpful, I think, to our preparation for that discussion at the board meeting in September in terms of potential changes that could take place.
Yes. And Josh, if you do find anything, because as I was sitting here thinking about my specific training in that was 36 years ago, it suddenly, came to me that if you had somebody sitting in front of a touch screen, there's a lot of that kind of manipulation, card sorting, those things with diagrams that you could absolutely do in that fashion. And all it really takes is somebody to create it and to norm it, right? And then be able to say it absolutely can differentiate in terms of people's adaptive learning or their intelligence the way these other tests did. But it doesn't sound like we're there yet. But if you learn more about the way, as you described it, people are being trained online, but likely in much the same fashion, that might be helpful, because personally, like I said, the core faculty piece has become less of an issue for me. I think the in residence with the psychotherapy class is less of an issue for me. And if somebody could explain, as Tom said, that this testing can be done in a way that maintains a level of quality and competence, then I would certainly feel better about that. But it also sounded like, from what you were saying about the school psychology, that the kind of hybrid manner is to say, you're going to do a lot of training online, but then you're going to come and do some pretty intensive stuff on site to get this particular group of skills.
Yeah, it's a 40-hour a week when they come on campus. I mean, they really get after it for a full week with lots of experiential stuff and doing all the things that we think would be appropriate to hit hard in person, and then take those things and replicate them where they came from, to continue learning, get feedback and all that. So, yep.
Well, I appreciate the very robust discussion. In the interest of time, we can move to the update on the board's decision on postgraduate supervision and definitions. And Dave, you talked a little bit about that. Is there anything you wanted to add specifically?
Just that, those changes were put into place in 2208, and we have received quite a bit of positive feedback from members of the public and also from different associations concerning those changes.
Legislature.
And the legislature as well. They did speak positively about it. And I don't think it was a coincidence that the BSRB bill was the base bill for all those other bills. Just to let you know, at the legislative meetings, outside of those, I did hear from people that they really thought the BSRB bill was strong in large part because of some of those changes. And that's why I think our bill kind of was what they call sometimes a vehicle, where other people want to come along for the ride because they think a bill has a very strong likelihood of passing. And so I think it speaks to a lot of the positive changes that were in the bill. But no, just to give you a little bit of feedback, I described some of those changes earlier when I talked about the executive director's report, but I thought it might be helpful for you to know too, just the sentiment and things that we've heard so far as more people have become aware of those changes too.
I would echo that, particularly I think in rural and frontier areas, the ability to do all supervision via televideo really saves individuals who sometimes are living in an area where they wouldn't be able to find a person with the same type of licensure they have in order to get the advanced clinical supervision in their area. and might have to drive hours to find that person. So being able to do that all by televideo is, I think, a really, really positive move. And the telephone, under extenuating circumstances, because I've also been reminded by folks in the area where I live that it can be somewhat of a broadband desert in certain areas, and not everybody has access to high quality broadband. And I think all of these issues really bring, for me, that struggle between the recognition that across the state there are significant workforce issues and people who need care that are having trouble accessing care. And the other side of it, our obligation to make sure that the people we license to provide that care are competent and able to do that in an ethical and adequate manner. And it's really felt to me recently like those two things have really been kind of pushing against each other, with some people really wanting to relax standards in order to get more providers. And then the natural push to say, boy, it doesn't take but one case of a bad provider and the number of people whose lives that they can really impact in a negative way. Anybody else want to chime in? 4.5 minutes.
It's hot outside, Dave.
It is unbelievably warm. Developing quite a case of back sweat as I sit against this. Any additional items? So let's look at the calendar. Anybody got that open in front of them?
Yeah, so if you wanted to stay with the third Thursday of the month, and the advisory committee does meet every other month, then I believe the next meeting would be on Thursday, August 19th.
That'll be before the out of town meetings. Have anything else?
I can't do that day, unfortunately. I don't know what that means for the group. I'm not saying to change it necessarily, but I'm in an all-day deal that day.
When's the BSRB meeting? Or is there one that month, since there's one in September?
That would be in September. Currently, there is a BSRB meeting that would occur on September 13th. The out-of-town meeting is scheduled for Monday, September 27th. And I believe what the board talked about was they may decide to just consolidate and have all of the items done at the big meeting on the 27th, or the board might decide to have the regular meeting on the 13th and then dedicate 27th to more of the larger discussion items. But right now, tentatively, the next board meeting after July would be in September on the 13th, and then there's the larger meeting would be on the 27th. So you will still have an advisory committee if you meet in August. That will be before those board meetings.
Can you send out one of those, what are they called? Doodle polls for the week?
Sure.
And August 19th, and we'll see what other times might work better for everybody.
That would be great. And I don't mean to be on Thursday afternoons, once the academic year starts, unfortunately, I have a class from 1:30 to 4:30 that I'm teaching that every Thursday. So
No, that's fine, actually. Appreciate if anybody, sees things in the future, because we have enough time, we can always make an adjustment.
so sorry about that. If the slot really works for people, I'm sorry if I mess it up.
Yeah, Josh, way to be. mess it up for everybody.
And if you're not used to using Doodle Poll, what I will do is I will set up it's just a website service that I can send you a link to go ahead and enter that, and it will show certain options that are blocked. So just go ahead and select all of the ones that you have available in your schedule. And then based on the ones that get the most feedback from individuals, I'll let you know. But I also know that sometimes those go to people's spam folders. So I'll go ahead, once I have that scheduled and set out to people, I'll send an email so you'll know to look for that in case it doesn't appear in your inbox.
It goes to my junk email every time he mails it out to people.
I would question, since the board meets, you said on September 13th, would it be good to postpone our meeting until after that? We're only talking a couple weeks.
Well, and just to let you know, I'm not 100% sure that that meeting will take place on the 13th. Because the board did talk about, there's a couple of options. They might go ahead and keep that as a traditional board meeting and then have the longer one on the 27th, sort of the retreat or offsite meeting. So that it's possible that they may have both those meetings that month, or they might just have the one meeting at the end of the month. I think that's something the board will probably discuss in the next board meeting in July. So.
Well, I would be fine meeting in August if we can find a time that is appropriate, and if there is work that we need to be doing. Otherwise, I would also be very fine with postponing until after your September meetings, whenever they take place.
So we should know, Dave, right, after the July meeting, that should be pretty well firmed up.
Yes,
So
at least.
So let's do the poll. We'll get a tentative date. Then after the full board, we'll have an idea how much, whether there are any pressing issues or whether we push the advisory one back. And part of that, I would assume, is also going to depend on if we get our letter out, we have applications for advisory committee members, we'll need to meet just so we can go through those. So we'll try to both have a tentative plan and be flexible and see what the needs are. Well, there we are. We just crossed the line. Thank you all very much. Appreciate your time and attention and hard work. Stay cool. Enjoy. I was going to say enjoy the rest of the week, but it's going to be hot as hell. So.
Well, Dave, you'll see the cool weather before we do.
I'm happy to hear that. I saw that it was going to drop down for one day, but my wife, who's looking forward to harvest, couldn't be happier that it's hot and windy. So there you go. See you all.
Thank you. Bye.
Thank you.